Welcome to our channel. Today, we're diving into an important health topic that affects millions around the world: pneumonia. It's a condition we hear about often, but many don't fully understand its seriousness and how it affects our bodies. Now, when it comes to your health, knowledge is power. That's why, in this video, we're going to break down everything you need to know about pneumonia, from what causes it to how you can protect yourself and your loved ones. Stay tuned to learn how to stay one step ahead of pneumonia. What exactly is pneumonia? It's an infection that inflames the air sacs in your lungs. These air sacs, called alveoli, are vital for breathing. They fill with air when you inhale. Pneumonia inflames them, filling them with fluid, making it hard to breathe. It's especially dangerous for older adults, young children, and those with weakened immune systems. Pneumonia isn't a one-size-fits-all condition. It can be caused by different culprits, and understanding these distinctions is key to proper treatment. The most common type is bacterial pneumonia, often caused by bacteria called Streptococcus pneumonia. This type can be quite serious, leading to high fever, chills, and difficulty breathing. Then we have viral pneumonia, which is often linked to viruses like the flu or even the common cold. While it can be milder than bacterial pneumonia, it can still make you pretty sick, especially if you have other health conditions. And finally, we have fungal pneumonia, which is less common, but can be quite serious, especially for people with weakened immune systems. It's caused by, you guessed it, fungi found in the environment. Now that we know the different types of pneumonia, let's talk about what actually causes them. As we've discussed, infections are the primary culprits, but there's more to the story. Bacteria, viruses, and fungi can all sneak into your lungs and wreak havoc. These germs are often airborne, meaning you can inhale them from a cough or sneeze. You can even pick them up from surfaces and then touch your face, giving them a free pass into your system. But it's not always about catching something directly. Sometimes, pneumonia can develop from an infection you already have, like the flu, that travels to your lungs. This is why it's so important to take care of yourself when you're feeling under the weather. While anyone can get pneumonia, some individuals are more susceptible than others. Knowing if you fall into a high-risk group is vital for taking extra precautions. Age plays a significant role. Infants and young children with their developing immune systems are particularly vulnerable. On the other end of the spectrum, older adults, especially those over 65, are also at increased risk, as their immune systems naturally weaken with age. People with weakened immune systems, such as those undergoing chemotherapy or living with HIV/AIDS, are also more prone to developing pneumonia. Chronic conditions like heart disease, lung disease, and diabetes can also increase your risk. Early diagnosis is key when it comes to pneumonia. But how exactly is this respiratory infection detected? It often starts with a physical exam. Your doctor will listen to your lungs with a stethoscope, checking for any crackling or wheezing sounds that could indicate fluid buildup. They'll also ask about your symptoms, medical history, and any recent illnesses. To confirm the diagnosis and determine the type of pneumonia, further tests might be needed. A chest X-ray can reveal inflammation or fluid in your lungs, while blood tests can help identify the presence of infection and rule out other conditions. In some cases, a sputum test, where a sample of your phlegm is analyzed, can pinpoint the exact cause of the infection. There are steps to reduce your risk of pneumonia. Prevention is better than cure. Vaccinations are powerful tools. Get vaccinated against flu and pneumococcal disease. Good hygiene is crucial. Wash hands frequently or use hand sanitizer. Cover your mouth when you cough or sneeze. We've covered a lot of ground today, from understanding what pneumonia is and its causes to exploring the different types, risk factors, and diagnostic methods. But remember, this information is not a substitute for professional medical advice. If you suspect you or someone you know might have pneumonia, it's crucial to seek medical attention promptly. Early diagnosis and treatment are vital for preventing complications and ensuring a speedy recovery. Don't hesitate to reach out to your healthcare provider if you experience any of the symptoms we discussed, especially if you fall into one of the high-risk categories. Remember, taking care of your health is paramount, and being informed empowers you to make the best decisions for yourself and your loved ones. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips and information. Stay healthy and take care.